So once you've started to thaw your bottle, at this point you're going to want to go into your baby's chart through Bridge, scan the baby's bracelet, and then prepare the bottle so that you can print labels for administration. Once you go into the baby's chart, you'll open up Bridge and scan your baby's bracelet. And that will bring up your options for preparing the bottle. You'll use this to print up your labels and also print your storage bin sticker. You go to Prepare Bottle, and here you'll take your bottle of donor milk, scan the bottle. It will then highlight, divide, add fortifiers, print labels. When you select print to print the labels, you want to print several labels to then have in the bin. When you print up the labels for administering the bottles at the bedside or the syringes, they will have a little D in the corner, and that's how you know that you have prepared and printed stickers for donor milk. It will also show you the 48-hour expire time. For pasteurized donor milk, there is a different expiration compared to mom's own milk. The pasteurized human donor milk, it expires 48 hours from the date and time of thawing. And for mom's own milk, if it is frozen and then thawed, that needs to be used within 24 hours. When you receive frozen mother's milk in the system and then you thaw and prepare it, it's the same process of editing the state of the bottle and then preparing it. But it will identify it as mother's own milk, and when you prepare the new stickers, it gives you the 24-hour expiration date and time. For this demonstration, we won't actually be pouring any of the milk out, but just so you can see the process, you want to wear gloves. When you are opening the bottle, if you are drawing the milk up into a syringe for a smaller volume, you don't want to put your syringe into the bottle. You would take the cap off, pour the measured volume into a medicine cup. You could then take your syringe and attach a straw, draw it into your syringe, and then apply a cap for warming in your warmer. If you were pouring a larger volume into a VoluFeed, you don't need to use the syringe or the straw. Open the bottle, carefully pour it into the VoluFeed, apply the lid, and then place it into the warmer for warming. When you complete using a bottle of the donor milk, if you have to discard any of it, please make sure that you record that on the log sheet just for tracking purposes so that we can keep count of how much is discarded. If you use a bottle completely, then it is important to dispose of it in Bridge when you're done, and that can be when you go into browse bottle history. You can dispose of it through there. That's probably one of the easier ways to find it. Or if as you prepare the bottle you are printing a label and know that you're using up the rest of the bottle, it will ask you, do you want to dispose of this? And you can select yes. Do not do that if you're not done with the bottle though, because you will lose the bottle and you can't get it back. When babies are discharged from the hospital, they may still have milk that moms will be taking home with them. If that milk has been received in the system, then we need to make sure that we discharge it home. One of the things that you will see coming up is that on the discharge checklist sheet, you'll need to go into Cerner and either discharge the unused bottles of mom's own milk, or you'll need to dispose of the bottles of unused pasteurized human donor milk. When you're printing the labels up for administration of the donor milk, it actually creates bottles. And if we don't dispose of them at discharge, then it's a bottle that's living in the baby's chart forever. So for tracking purposes and for accurate documentation, we will need to dispose of those unused bottles. Same thing, you go into the baby's chart, browse the baby's bottle history, select all of the donor milk bottles that weren't used because there were extra stickers, and dispose of them. So I'm sure there'll be questions as we are fine-tuning that process, but just know that that is going to be coming down the pike. Because we're now getting to the point of having sometimes multiple babies that are being supplemented with donor milk at the same time, we are able to utilize one bottle between babies. You still use the same process for printing the labels for each baby, and then they all have their separate bin for labels and inserts. But because we don't receive one bottle into a baby's chart, we can use it for multiple babies. Just make sure that you label the log sheets accordingly with each baby's individual stickers. We do need to continue receiving mother's own milk in Bridge as well, as we have babies who are going to be staying a little bit longer, mothers who are pumping, and then their breasts are beginning to fill, so they're pumping larger volumes. The likelihood is that they'll need to store their milk in our nursery refrigerator. If that's the case, the nurse caring for the mom or baby can print up labels for breast milk to have at the bedside. You can print up 10 or 12 of these labels, so when mom pumps, she can label her own milk. We can receive it in the room at the bedside and then transfer it into the nursery. It is important to label the milk before it leaves the room for identification purposes, and being able to store it in the nursery. And then when mom needs milk, she can let us know, and we can prepare it, and then prepare it, warm it, and bring it to the bedside for scanning to administer. For mothers who have expressed their colostrum at home and frozen it, we can use the same process for printing labels, receiving, and identifying them as colostrum in the system. It gives you a little checkoff box if it is colostrum, and then when we're ready to utilize that, thawing it, editing the state in browse bottle history like I had mentioned, and then preparing and administering. When you are supplementing a baby and you're possibly doing this for several days, either if the baby was a late pretermer and is needing to get supplemented with each and every feeding, it is important to use the appropriate volume for supplementation. In your policy section of the logbook, there are two different policies that outline the supplementing guidelines for volumes. You have your donor breast milk policy. On the second page, it does have a breakdown of the age of the baby and the appropriate volumes for supplementation. And then we also have the late preterm feeding protocol, which has a breakdown of volumes. That tends to be just a little bit more specific and fine-tuned with the volumes. So just know that those are both in here and available for your reference. Of course, communicating with the pediatrician and looking at each baby's individual needs. But know that those estimates are available for you. to use. We do, the one that is attached to the countertop for a quick reference is the donor breast milk policy. And then the late preterm protocol is in the book. So, but it's just here for a quick reference. Nice to have.